Holder, if you can wipe off that seat for you and get ready for Dr. Michael Lim, cardiologist with SLU Care and SSM Health SLU Hospital. Good morning, Dr. Michael Lim. How are you?
Good morning.
Good morning.
Let's talk about this story on the front page of the New York Times yesterday where I found it, and that's new recommendations for doctors treating back pain. What's going on?
So, big deal. Everybody's got back pain, right?
Right.
I think the thing that we need to tie this story to is really a narcotic and opioid epidemic that's going on in this country, because these two are related, like the right and left hand. The back pain is very, very, very common. When people get it, they hurt. They sometimes become incapacitated, and the expectation from them as well as the doctors is to treat the pain, and so you use pretty potent narcotics to try to treat the pain and get instant relief. The American College of Physicians looked at this and said this provides very little benefit, and it doesn't help to heal the back. It doesn't actually help the actual problem with the back. It sort of masks the pain of the back. And so their recommendations are to do anything other than that.
I'm not a doctor. I'm just a regular talk show host. This seems like this should have been a directive 10 years ago, 20 years ago, 50 years ago. Why is it taking so long for them to come to this conclusion?
Well, this one, this one's pretty controversial because of expectations. And because it's very hard to do. This is, if I want to give you a parallel, this is like you're the parent and your kid has an infection, a cold, and you take your kid in for a visit, and you want antibiotics because, man, I mean, when your young one is sick, they're miserable, and if they're miserable, you're miserable, and you want that over.
Right.
And there's been a tremendous push from parents to say, no, I need an antibiotic. You need to prescribe an antibiotic. And the pediatric groups have done a much better job over the past several years saying this is a virus. We got to withhold using antibiotics. It actually doesn't help. But this is a very similar kind of thing. It's very hard because of expectations. Mm-hmm. The other part that's really hard is, how payment is actually changing around for physicians and for hospitals. Payment is starting to change around based upon patient interactions and patient ratings of their doctors. And so, if you go into your doctor with low back pain, that hurts really bad, and you have a hard time sitting in that chair to do your morning show because you're in so much pain, you want that pain gone so you can actually do your job. And if you go to a doctor and that doctor says, actually, this is going to be weeks for this to get better, and potentially some massage therapy, potentially consider some acupuncture therapy.
Right.
You got to rest it, so you got to stop hurting it on a weekly basis, and take some potentially anti-inflammatory medications and use heat and cold. You most likely are not going to be very satisfied with that visit.
Right.
And you go someplace else, and then potentially that doctor will give you some narcotics.
All of a sudden, you're a terrible doctor because you're telling me not what I want to hear.
Absolutely.
But the truth, and I don't want to hear that. You're a terrible doctor. I'll go to the doctor who just tells me what I want to hear.
So that's a big piece of the hard part about this. Lower back is something that we abuse. As people right now in society, we've abused it since we were young. Everybody picks up heavy objects wrong. They lean over from the waist. Everybody does a lot of things wrong. Chairs and other opportunities to be ergonomically correct so you stop hurting your back on a daily basis. Mm-hmm. Most people take shortcuts because they can get away with it when you're young, but then it ends up building up on you.
Yeah. Well, and there's also, look, people need to lose a little weight, work on their stomach muscles, work on their hamstring muscles. I could see, hey, I'm really, really hurting. Okay, I'll give you a couple of pain pills, but that's not, you're masking the problem. Now you need to do these other things to solve the problem.
So that was the point, and I think this is going to be very hard to adopt these recommendations based on the conversation we just had. But I think the expectations from your listeners are, lower back pain's bad. There's no doubt, and any doctor that doesn't have compassion and a concept that it is, that is an issue.
Right.
But with respect to how to actually get that fixed and treated, looking at what's the underlying problem, what is the right treatment for this, I think very clearly, almost all the time, that's not narcotics.
Right.
And that's the principal message I got out of these changes and
Right.
recommendations.
I have back pain from time to time, and I go to my chiropractor, and he cracks me a couple times, and I lose a little weight, and I do some sit-ups, and guess what? My back feels 100 times better.
Or, doing stretching. That can
Right.
do so much for your body.
Yeah.
So yoga.
Yes.
Yoga. So, and then there's, I just learned about this last week. After I hung up the phone with you, I met a young lady, and she's a yoga instructor. She teaches hot yoga.
And that's really
And so
great
hot
for
yoga,
the
you do it in a
joints.
room that's like 85 degrees.
Right.
And so it limbers up your muscles and allows you to become more flexible and more pliable.
Yes.
And it would be great for back pains and flexibility.
Is that Bikram yoga? Is that what that is? Is that a form of that hot boxing?
Hot yoga. I'm not an expert, but
Yeah.
I'm familiar with hot yoga.
Yeah.
Yeah, so it's technically not the exact same thing,
Got it.
but very similar.
Dr. Michael Lim bringing it again today. He is, his official title is cardiologist with SLU Care and SSM Health SLU Hospital. Doctor, great stuff. Thanks for coming
All
in.
right, have a good one.
826, Big 550.